Hello. Message for the week is heat stress. And that is for the week of June 26th. This is from the CDC. So everybody, it will be sent to them. Things that workers should be aware of. Environment. High temperatures, especially with high humidity, make sweating less effective. Direct sun exposure. Lack of wind or breeze to cool the body. However, when ambient conditions are higher than body temperature, warm airflow can actually increase heat gain. Proximity to engines or other hot equipment. Things to keep in mind. Activities. High exertion, not enough rest breaks, repeated strenuous days of heat, high motivation to push through discomfort from heat strain. No acclimatization, meaning they're new at the job, experienced employees returning from time away, okay, and it simply means getting acclimated to the heat. Experience sudden change to worksite temperature, such as heat waves, got to be aware of that. Also, medications. Heat tolerance can be affected by the medications that we take. Cold allergies, congestion, muscle spasms, blood pressure, urine production, high blood pressure, diarrhea, dizziness, vertigo, depression. Dehydration is one of the absolute most important risk factors. Prior to heat illness, increase the risk of heat illness in the future. Other factors: age over 60, non-breathable clothing, personal protective equipment, alcohol use in the last 24 hours. Health conditions. There might be short-term illnesses such as diarrhea, vomiting. It could be respiratory infections. Chronic conditions such as diabetes or heart disease. Being overweight or obese. Because obesity, believe it or not, does have an effect. Poor physical fitness. A worker may be affected by many risk factors at the same time. Talk to a healthcare provider about those risks. Page 2, points to remember. Acclimating ourselves is critical to the conditions. Lack of acclimating ourselves is a major factor in heat-related deaths on the job. Hydration, critical. Dehydration greatly increases the risk of heat illness. A recent illness can temporarily lower your heat tolerance. Keep that in mind. Be aware of other personal risk factors for heat. Prior heat illness, certain medications, certain health conditions, alcohol use within the last 24 hours. Case showing hazards of heat illness even when acclimated workers. Here's an example they give of a 27-year-old employee. 2 years mining experience and coming to the end of a 12-hour shift at a mill. Okay? Although he did not lose consciousness, he missed 2 days of work due to the incident. Lessons learned: young, healthy, and experienced, anyone can get heat illness. This incident may have been related to the employee's high blood pressure medication. Multiple factors together, such as certain medications, a recent illness, or repeated strenuous days of heat, can increase the risk of a heat illness. Please keep these things in mind in the days and weeks and months ahead. It is summer, and make the right choices. And drink, and stay hydrated. And if something's wrong, tell your supervisor, tell somebody in charge immediately. Have a great and safe week, everyone.